right, a C from Chris. Stigma. Okay. What else do we have there? Culture. All right, you're speaking my language now. Fear of losing your ticket. Yep. Thinking it'll get better on its own. Excellent. Invincibility. What are you trying to say there? Type A personalities have invincibility? Denial. Okay. Excellent. Well, those are some great responses that all go into what we look at as barriers to care, not the river in Egypt. Very good, Chris. Good. So when we look at barriers to care, we look at three basic tranches of barriers. We have stigma, we have attitudinal barriers, and then we look at logistical barriers or practical barriers to care. So under stigma, multiple different types of stigma. Organizational level stigma. What does the organization think? Cultural level stigma. What does my culture or my organization's culture see? Along with peer stigma, what do my friends and family and neighbors and coworkers think? Self-stigma, what do I think about the idea of me having a mental health issue? And in the aviation community, also, and in others as well, but medical stigma. What is my doctor going to think if I come to them with this issue? How are they going to treat me when I have other issues that may come along? Are they going to write it off as this? Are they going to treat me differently? Now, attitudinal comes more into how I think of mental health myself. Do I have a lack of confidence in what mental health treatment can actually do? Maybe, as was mentioned here, a perceived need. I don't really need it. I can handle this all on my own. Or even negative views of mental health treatment. Only people who are crazy go for mental health care, right? I don't have to have that. And then finally, we look at the logistical aspects of it. Financial issues. In the aviation community, availability and scheduling. I may be, if I'm an aviator, I may be in other side of the country on any given day, and I won't know until a couple of weeks beforehand, or maybe even days beforehand. How do I try to schedule with a mental health practitioner during those time periods? These are all different areas that come up. Now, some recent studies have shown that organizational stigma and cultural stigma tend to be some of the highest areas, the highest barriers that aviators are facing when it comes to getting their barriers to care. Well, I'm afraid of what's going to happen if it gets into my medical records, as was mentioned here. I'm afraid of how the organization is going to affect it. Even if my organization today is okay with it, what happens when I change jobs? Will they be okay? Will they even hire me on if I have a history of mental health? I see another comment in here. I'm going to scroll down to that real quick. Okay. On the attitudinal side actually comes in second in some of these studies with, as I believe it was Chris mentioned, the idea of I can fix this myself. That self-reliant attitude of I don't need somebody else to fix me. I have the ability to do it myself. It's going to get, or as Anna mentioned, it'll get better on its own because I always have to fix things myself anyways. Generally, the logistical areas have actually been pretty low when it comes to some recent studies. But that continues to be an area to explore, and we've had the benefit over the last few years of telehealth being able to break into that availability and scheduling of that mental health. But there's still that question, that practical question, which kind of varies between that practical, logistical, and the stigma of if I get help, what are going to be the ramifications? Can I use this? Or is it going to cause me problems later on down the road? What type of help can I get that's allowed and what's not? Well, what are the ramifications of these barriers? Well, what we've seen is 56% of aviators in one study admitted to healthcare avoidance behaviors. That's going to alternative care so they didn't have to disclose it. That's not disclosing different symptoms they were having to their AME, flying when they knew they weren't supposed to be flying, or operating when they knew they weren't supposed to be operating, or taking medication they knew they weren't supposed to take. Well, when we break that down even further, we can see that the recreational community was just under 50%. So those are your everyday pilots that are going out just to fly for fun. 66% in the commercial community, and then 75% in the UAF and the Air Force community of those surveyed in the sample. The next area that we look at is presenteeism, which is showing up to work when you shouldn't be at work. 63% in one study admitted that they showed up to work often when they weren't required to, with only 25% saying that they had called in sick the year before based off of feeling unfit to fly. Now, here's the kicker. When you get down a little bit lower, you can see that 69% of those who admitted to presenteeism admitted to making mistakes in the flight deck, on the flight deck, within the last 12 months that were of a non-benign manner. So something that could have affected the flight if someone else wouldn't have caught it. These are starting to get that impact of these barriers and this avoidance. And we can start seeing the safety issues that come into play. It's not just not a well-being issue for the aviator or for the air traffic controller or for the maintainer. It also has its impact on safety. 36% also reported those poor mental health days. So again, when we take that 36 and that 63, quick math and public and add them together, that comes up, we can see the different effects that are having there. But that's not to say that we're not making progress. We are. You look at the industry, starting with CISM, then moving into the peer support programs and employer assistance programs that are out there now, the EAPs that are available within the industry, helping individuals get the help that they need, helping to provide an avenue for help seeking. And then when we look at the regulators, we're also seeing those improvements, especially over the last 9 months. Medication approvals for those with depression symptoms, increased acceptance of mental health within the community, the AME approval process that just went through recently, and with the ARC. We're seeing these benefits that are coming out of this. We're seeing improvement. But recent studies still show that pilots still believe that disclosing a mental health issue or seeking care for mental health will end their career. So how do we improve this? Ask you again to hop into the chat window. What are some ideas that you have that might help to improve our view of mental health, to see it as a safety risk, to see it as a safety behavior for aviators to take and for aviation personnel? So go ahead and pop into the chat window. Leaders talking about their own mental health journey. Excellent. Yeah, that's a great example in the on the military side. I had a brigade commander who quite often would talk about his situations that he had where he had to seek help, and it really helped to start destigmatizing the military's or our organization's focus. Safety culture within SMS process, absolutely, Chris, and that's an area. ASMA's mental health working group, absolutely. Great organization, great activities that are coming out of there, great research that is coming out of that working group, and some recent research that's in the work right now on safety culture within the SMS process. Education about the effects of mental health problems. Okay, so yes, the impacts of those problems of mental health. Oftentimes, I think we end up focusing, the media especially focuses on these major events where, because of someone's mental health symptoms, they have uh, taken an aircraft and done something with it. Different issues that we've had there. Whereas the more latent issues are probably those that really raise the risk level rather than one catastrophic event. HIMSS worldwide peer support effects for safety sensitive. Okay, yep, FA, yep, below wings, revolutionary change under. Yep, absolutely, Chris. We are seeing some great changes, but we're still seeing those aviators and aviation personnel that are avoiding seeking help. One area that might explain this is the idea of organizational culture and organizational cultural change. So when we look at Shine, looks at organizational culture, one of the things he talks about is the idea of we have artifacts and espoused beliefs and values that affect the climate of an organization, and then we've got those underlying assumptions underneath that really hold on to that culture, right? The roots of a tree, if you would say, the invisible portion. When we think about artifacts, these are things like policy changes, rules, new methods that are out there. There are aspects that are right there on the surface, the messaging that's going on. We've seen changes there. Then we get down into the espoused values. In the espoused values, that's where, what are leaders, as Anna had mentioned, what are leaders and regulators saying about mental health? But then on the other side of that, what are aviation professionals seeing as a result? Are their actions or the perceived actions matching up with their words? And then once we get down to that, then we get down into that culture. And the culture that's ingrained in general already is that idea of, from the beginning of many aviation careers, you don't seek help because that's a red flag. It's going to keep you from flying, as been mentioned. Um, you don't trust the regulators. You don't trust others. The area of that self-reliant mindset of I can fix it myself. The things that we saw when it came to those barriers, many of those tend to be that underlying culture that we see there. So, if we're seeing these changes up on top, they should just flow down to the bottom, right? Well, if we look at organizational change, we have primary embedding mechanisms, and then we have secondary reinforcing mechanisms. And primary embedding is what gets it there, and then the secondary reinforcing is what keeps it into the organization. Well, right now, if we look at this list of different areas, the stuff on the right-hand side is really where most of the actions have taken thus far. Organizational systems and procedure changes, stories about the importance, important events and people, those examples that are being given by regulatory agencies of, hey, look at how this has happened and look at how this person was able to get their medical back, or these people were able to keep their medical. And then formal statements like the mental health minutes and other aspects such as that. To be able to really get this to change, though, perhaps what we need is more time focused on examples of what leaders are actually paying attention to. What happens with these policies as they're implemented? Over time, are we going to see, and we are talking with other aviators, what I'm seeing right now are positive changes to how mental health is handled at the AME and from those at the FAA when it gets up to that area. How things are being reacted to when there is a critical event. If a person has to stop a flight because of a mental health concern, um, how is that going to be reacted to? Is it going to be oh, hold on, we got to pull back all of this? Or if someone has a problem who is on one of the depression medications, are we going to see a closing down of that? Or is it going to be accepted that, hey, we understood that if there's no risk, then that means we're not flying. And some of these things are going to happen, but they also happen even when we don't have these different options available. And finally, how are people able to continue to promote and continue on after they have had a mental health condition diagnosis? I see this very much like how we see hymns today, where uh, people know that there is an avenue if you have a problem to be able to get the assistance that you need and to be able to get back into the flying community or the air traffic control community or the maintenance community, as it may be. So, where do we go from here? And actually, I'm going to ask you to answer that question first. Where do you see as the next steps that need to be taken to be able to help change the mindset, to help start seeing help seeking as a safety behavior within the aviation community? Go ahead and pop your words into the chat window. Normalize through example. Absolutely. And that goes right along with that center bullet there, right? That normalization of that health-seeking behavior. And where that comes from, when we start looking at the top level, right, recognizing help-seeking's influence, we're already seeing a lot of that, right? We're seeing the medical reforms. We're seeing what's coming out of the ARC, the peer support program, possibly the Aviation Mental Health Act that's working its way through Congress. So we're seeing some different areas there that show that recognition. The next step, though, is that normalization. Part of what that's going to come down to is as individuals start to come forward with mental health conditions to their AMEs, to the FAA, how, and other organizations, how is that received? If it is received as, yes, we understand these are our normal aspects there, then that generates more normalization. Understanding that the opposite occurs every time that there is a setback or a perceived setback. And that's the area that we're in now, is really the perceptions that individuals have of how well can we use the systems that are being presented. It's easy to say that 80 or 90% of people who have a condition or go to the AME are coming out with with an upslip, even with mental health or other backgrounds. But what about that 10%? In aviation, quite often, individuals look at the worst case scenario to ensure that they're prepared for the worst case scenario. Well, worst case scenario in many of these cases, in the minds of at least some aviation professionals and those type A personalities, is I'm going to lose my career. I'm going to lose what I love to do. AME improved training opportunities. There's another great area there. And it's something that I hear inside the community right now is, okay, I need to know what AME I can go to who is up to date on the information that's available today, the options that are available. Because I have heard within the last few months of two individuals with almost the same type of a background having very different results coming out of an AME, based off of the AME's familiarity with the changes to the regulations. And this is FAA specific here, but um, uh, their understanding of those differences. And so, how can we increase that normalization of mental health being an acceptable condition depending on the condition itself amongst the AME community as well? And then finally, we get down to that bottom area, that integrate and aligning towards safety. Something that Chris had brought up earlier, which is mental health in the SMS system, incorporating mental health into the safety management system. How do we do that? How do we do that at the individual task level? And then how do we do that at the larger level? How do we do it when we look at the bow tie and we look at ways that we can explore mental health and mental well-being and its ability to influence different situations and prepare for it. And then finally, as we look down at the bottom, do the policies and expectations from those policies meet the experience level of the individuals that are there? And when we bring that together, that is where we can chart to change the culture. We can continue to change the culture to one in which help seeking is seen as a safety behavior, as something as normal and as beneficial as when you're using a checklist and doing your double check on the checklist, or in air traffic control when you're finalizing and double checking your different information that's there, or you're doing a toolbox inventory when you're finished with your work as a maintainer. That is the ultimate goal as we continue to look through this, is allowing at both the organizational and the individual level to reframe mental health as help seeking as a safety behavior. All right, I'll open up the floor to your questions at this time. Thank you very much. All right, if you've got a question, you can go ahead and raise your hand, I believe, or you can put it into the comment section. All right. Am I optimistic for the future? I am. I am very optimistic of the future. What I have seen over the last 9 months is something I have not observed in 30 years in aviation. Um, I am seeing aviators and air traffic control personnel who had deep-seated and in some cases realistic fears of discussing and exploring the ability to get mental health, willing to get it, willing to explore the different options, and that they're seeing positive results when they go to the AME. AMEs that are using the checklist, the form flow that the FAA has provided to allow them to approve at their level, or even those that are being sent forward, that those are being reviewed and they're seeing, at least what I'm hearing is a belief that they're being fairly treated. Whereas before, the fear, the expense that was involved quite often from the different exams that were required, and the time that it would oftentimes take to get through the process were things that made people hesitant to even consider the idea of disclosing any type of a concern that they may have. Um, oops. Okay, we go. Got a couple of them that popped up there. What do you think about ATC during? Yes. Well, obviously, air traffic control has had a very traumatic week, and that was actually something um, that I was when I was talking with a friend the other day mentioned was one of the unique areas in both aviation as a pilot and as an air traffic controller are the requirements to continue in that high stress environment even after an incident has occurred, right? There's not that option to just stop. And I think a great example of that is with that air traffic controller who had to continue with coordinating traffic, coordinating an emergency response, and otherwise after having observed the incident and even saying over the radio that he felt that he had made a mistake that resulted in that incident. Uh, Thank you, Dr. Stafford. I appreciate it. Absolutely. I mean, that's being in being in the profession and continuing to fly and having worked with air traffic controllers and worked with maintainers throughout my career, um, taking research and just putting it on a shelf is something that I just feel is always is a waste. Being able to take it and to apply it to practice and see how we can use it in practice is really what becomes important. Otherwise, yes, there is a place for research to go on the shelf and to help build additional research so that we can better understand a situation. But the quicker we can apply what we're learning, the better off that the community is and the better off we are on a safety aspect. How much is acceptability based on changes in aviator community attitudes towards mental health changes? Huh. Okay. So let me make sure I've got this right, John. Um, how much does the aviation community's acceptability change based off changes in the medical community about mental health issues? So, interesting area here. So, if we look at the younger population, especially when we look at individuals that are going through flight training right now at aviation affiliated colleges and universities, you know, we are seeing that change in that acceptability, and it's actually it's almost created a situation where regulators were forced or put in a position where it felt almost like there was going to be a force to have to make a change because mental health had been accepted so much earlier in their lives that many people coming through the aviation pipeline had mental health diagnoses in their backgrounds, in their medical records. And so finding a way to ensure that we were starting to make a different look at how mental health was treated became very important if we were going to continue to have air traffic controllers, aviators, and others in those critical fields to be able to provide. And it was quite interesting. Again, you go back just 5 or 6 years ago, and you could see the tension that was occurring in those areas. And we've seen similar things in the military where we've had to relook how we are going to deal with different diagnoses that have been there based off of the both the acceptability that those have seen that individuals have taken, but then also the way that the medical system works with an indirect requirement that you have to have a diagnosis in order for insurance to pay for things, which goes back to those um, healthcare avoidance areas that we saw in some of the recent studies by Hoffman, where he looked at where individuals were looking at going off market, as it would be, paying cash so that they're didn't go to their insurance company so that they didn't have to have a diagnosis, or going to other holistic and alternative care facilities in order to get that help that they needed. I hope that answered the question there, John. All right. Do you have any minus HIPAA information success story? Yes, I do actually. And I was talking to a buddy of mine who works for an airline, who he is part of their peer support program, and he was asking the same question. Um, I have talked with individuals who have come out of the military. So let's start with the whole issue of uh, many military members are now getting into the aviation community, and they have things in their VA disability ratings, which the FAA considers to be if not a diagnosis, at least it is something that needs to be disclosed. Um, I have talked with individuals who have more than 50, upwards of 70, and some maybe even higher. At least I've heard of 70 percent disability ratings from the VA for mental health conditions that have been either well treated and previously, or that were not symptomatic in an area of the aviation concern that have received their first class medical that's received their first class medical. So we're seeing success stories there where people, whereas again, just 4 years ago, the word coming out of the military was when you're going for VA disability rating, push as hard as you can for if they're gonna find something mental health wise, put for an adjustment disorder rather than any actual condition, because that's because with an adjustment disorder, there's a lot more variation that they can have with the AME level. Well, now with the latest changes, there are some abilities to go ahead and go further with that. And we're seeing success stories there. Additionally, those who are seeking help while they have their medical. Um, I've heard many discussions with individuals that have said, I went to go seek talk therapy. I disclosed it on my medical, and I was approved going straight out the door with the AME with an explanation as to what the talk therapy was. But their description was barely a blink from the AME about the talk therapy area. So very good success stories there. On the other hand, I have heard others that have said the AME I went to had no idea of the recent changes, and automatically deferred me as soon as mental health was brought up, or as soon as I provided my VA disability listing, I was deferred. So these are the other sides of the coins there. So there's still work to be done, but we are seeing that positive progress. Okay. Oh, okay. Oh, that would be great if, sorry, uh, Dr. Stafford just mentioned that she is a retired MEB, Medical Evaluation Board. Correct me if I'm wrong on that acronym. MEB provider for the Army. That would be a great discussion for a webinar moving forward. Thank you for that. We do have very many members of the military community that are interested in understanding how that process works. Excellent. Excellent. Well, thank you again, everyone, for your time today. Here is my contact information. Feel free to reach out if you have any additional questions. If you've got some areas of research that you think might be of interest, please feel free to contact me. And additionally, since we are recording this, I'll go ahead and throw up first, of course, the personal capability. Yeah, personal capacity. All comments here are those of mine and are not necessarily the official positions of my current or any previous employers or associations. And I use ChatGPT to make some of the different pictures that were on there. Along with that, here are the references for the different areas if you're interested in exploring further on the ideas of aviation mental health and the idea of safety within as a construct for the aviation mental health area. Thank you very much for your time. Have a good day.
Thank you so much. Oh, and Candace, could you put your email in the chat? Would be great to connect. Really appreciate everyone being here and such a fantastic talk, Aric.
Well, thank you very
Yes,
much, Anna. I
really
appreciate the
great.
opportunity to talk to everyone. Of
Sure.
Really great. Thank you.
course, John. Thank you for the invite and getting these webinars set up.
Sure thing. Great. All right. Bye-bye.
Oh, thank you so much, Candace. And I'll send you an email. The talk can be, I think we have July open right now. So the talk can be the day and time of your choosing. And it's actually great if the different webinars are on different days and different times. That way, if someone, some people always have a conflict with a given time. So this way, if they're on different days and times, more people might have a chance to participate. So thank you so much. I will send you an email right away.
What?
What's that?
Thank you.
Thank you. Oh, fantastic. And are you an asthma member by any chance? You don't have to be.
I am not, but I'd like to know more about it.
Oh, fantastic. Well, even if you're not an asthma member and not a requirement, but if you want to consider joining AsHFA, you can join the Aerospace Human Factors Association as an affiliate member, and it's a pretty low cost. And then if you decide to get more involved with asthma as well, of course, that's open to you, but that's kind of the larger umbrella organization. And then as the Aerospace Human Factors Association, we're the small organization under it that's hosting this webinar series.
Could you either we could talk offline or send me more information so I know the difference and whichever would be easier for you?
Oh, fantastic.
'Cause
Thank
I'd
you
love
so
to.
much. Look forward to connecting more.
Okay. Take care.
Take care.
Bye-bye.
Hey, thanks again, Anna, for getting all of this set up. Really appreciate the help.
Yeah, no, really appreciate you. Great, great talk. Just so fantastic. I mean, so important for the aerospace world, and really great that there's more and more attention being paid to mental health.
Yes, it is. It is. It's a. I was afraid it was going to stagnate after that initial push a few years ago, but it continues to move forward. So looking beneficial. All right.
Really, really, really great.
All
Okay.
right. We'll talk to you later. Thank you.
Bye-bye.
Bye.